Hi everyone, this is Dr. Khutbuddin Ali, your eye doctor. So, as you all know, I'm an ophthalmologist by profession, but at the same time, I make a lot of healthcare videos to raise awareness about eye health, public health, and all the general concepts that make you give a healthier lifestyle. So, apart from that, as you know, I am an MBA in healthcare and hospital management. I have pursued certified degrees in patient safety and quality of healthcare. So based on all these things and my little experience of more than 10 years in healthcare, so I would like to share a few inputs which will definitely help to give some guidelines to the National Healthcare Mission, to all the healthcare governing bodies to make sure that there is some quality healthcare assured. At the same time, the bridge between healthcare between rural India and urban care is little what you call coming down. So to make sure all these changes, let's come to some basic facts. Do you know how much our budget spends on healthcare? It's much lesser than most of the developed countries. We all know this. We all keep nagging. We all keep complaining that so the cost of healthcare is going very high. At the same time, the doctors are not giving enough time. There are no enough hospital beds in public hospitals. The public healthcare and private healthcare is quite different. So this is always there, especially when there are epidemics, whenever there are changes like new strain of viruses coming down, the hospitals being flooded, and the patients keep sending videos saying that they are not getting beds, all these things, so they are so distressing. As that will first thing that happens is it is hard to say, but the media projects only the negative factor of all this. The intention might be right to get the attention of the government to make sure that the healthcare providers are giving good care, but it is not going in the right way. So we have to clearly give awareness and facts to the public, because you might not read all the healthcare articles, all the government policies, whatever the tip of the iceberg that is being projected by the media, by the common public, by some people who want to spread the negativity in WhatsApp groups and all these things. This happens. So some guidelines you have to know is, as per the guidelines from National Healthcare Mission, the minimum budget that should be there for the healthcare is 2.5% of the GDP, total GDP. It's not there, it's very less. And as you know, because of the bureaucracy and all the changes of corruption that happen, even less than half reaches to the ground level. That has been happening from long time. Not that we are complaining that the health conditions are quite better from earlier, but still there are miles to go to improve. There are some good things to remember, because when we got independence in 1947, the average lifespan of India was 32 years. Now do you know how it is? It is 72 years. It is more than double, right? So definitely there are good things to cherish. There are good things to cherish, that we have the best healthcare system. Many big countries, developed countries, they look up to us in care of healthcare, the quality of healthcare, because we have excellent doctors. We have extremely well qualified, very much. You know, the Indian doctors are considered the best in the world. Why do you think so? Yes, we come up from such a tough exams. The only the meritorious students go through, but at the same time we have enough more than enough what you call patient load of all varieties. So we see from cases right from small cold, cough, malaria to the highest grade. So this amount of diversity in diseases, pathological factors will make a clinician much better in his or her aspect. So this is what makes an Indian doctor one of the best in the world. But do you know, if you consider, if you take the opinion of any Indian doctor, maybe just hardly 1 or 2% who are like doing very well economically, having their own hospitals, or who want to serve the country in a way irrespective of their basic needs, that is a different. But 98% of the Indian doctors, given an opportunity, they want to go abroad, they want to go outside. Why? Because their services are valued there, both economically, the quality of lifestyle, everything, the facilities there. Here, whatever the doctors, the hard work that has been put is definitely not encouraged in most of the scenarios. Rarely you see the video saying that the doctor has saved a life in an airport, in a flight, all these things. They come in a small column, but once it is done, again there are so many negative things that spread. So compared to the what you call cost of living and the income we get as doctors in India, it's nowhere comparable to the developed countries and other countries. So this is one big factor. The quality medical professionals, doctors, nurses, physios, all these, they want to go away from India. Why not? See, not forgetting that every doctor is himself or herself is having her or own his family. They want to feed their family, they want to give quality life to their family. So it is imperative that whenever they are getting good opportunities and the quality of work is also the same and even better working conditions, it is I don't think it's wrong to go. So the changes that have to be made are, definitely the government has to take steps to improve the GDP of at least 2.5% of the national budget for healthcare. There has to be public private partnership to run the hospitals. This is must. Many people claim that improving the healthcare conditions in government hospitals in public sector might improve the, it might not be possible, because the human tendency is when you are working in a public sector, so it is always happening. Because I run a few hospitals too, I know the ground reality, the mindset of the doctor staff or whoever, it's a harsh reality. I know some of the doctors working in the public sector might be angry at me at this factor, but this is the fact. The quality of care we provide in public sector might not be in parallel with what we provide in a private sector, because there is better supervision, better provision of facilities right away. If I ask for a machine, instrument, x-ray, CT scan machine or a scan machine, in a government sector I have to pass through so many stages to get it satisfied. But in a private sector, if the hospital management, the CEO or the top management feels that this hospital requires this instrument, if the doctor says that this is one, so they will provide it me right away. Maybe that is one thing. The hidden factor is, yes, they think that we can generate more revenue. Whatever said and done, what are we doing? We are giving better quality care to the patient. So this happens in private sector hospitals. So to bridge the gap between this one and the magnanimity of the need for healthcare, we have to have a PPP, public private partnership. Private hospitals have to invest in public sectors, some units have to be taken, and the quality care has to be monitored regularly by a commission. This has to happen. Second thing is, we are in a digital era. Everything you see, I think I have hardly used my wallet for the past 1-2 months. Rarely I get to take my wallet out. So most of the transactions are through digital UPI payments. So when this is happening so well, we can have a unified health record for all the patients, which might be attached to your Aadhaar card, your UDI card. So this is there, that every patient with that ID have all the healthcare data. So now we are taking our data for bank accounts, money, everything, all the matters which you don't like. But this is more important. This is more important, that you share the data with all the healthcare IDs. Everything is incorporated and you get a unified code. When once the regulated authorities have the access to this code, you get the complete data history of the patient. And based on this, you can use your AI interface. There are so many healthcare modules that it can be qualitatively assessed, that it can be coordinated. So when once a patient from this part of, I stay in Hyderabad, so some part of district, rural, like remote Hyderabad, if a patient goes to north or somewhere or northeast, so he has to entirely say the history. We don't know that patient might be in a state to reveal the history or not. The language might be a problem. There are so many conditions, but you have a unified health code. So the whole data history is available. You know the allergies the patient have, the health conditions, which healthcare style best suits him, and everything. And one more thing which senior doctors, like many doctors, Dev Prashad Sethi and many people, they have suggested is what you call an insurance policy. We spend money, like for many reasons, irrespective of our income, we are trying to use food apps, all these apps for entertainment. Make sure that health is a priority, the most priority. So some amount, say like 1,000 to 1,500 of your income, irrespective of whatever it is, you have to shed from your pocket. Not every time hope that the government is to provide you all the healthcare free of cost. No, it is your responsibility to. No matter how much the government is trying to do, if there is no partnership, if there is no participation from you, it will not happen. Maybe the few political leaders, they might try to manipulate you that this and that might happen, free healthcare and everything. It is practically not possible. They are best in their field, but as healthcare professionals, as healthcare leaders, we want to show that it definitely doesn't happen, that the government in such a big vast country cannot provide quality care for all the population unless there is a private enterprise entering into that one. At the same time, the public partnership, public what you call participation, spending money from their pocket. It is, if you know the reality in countries like USA, where much 12% of their income is spent on healthcare insurance, and even after that the policies are so bad in some aspects that the patients are not happy. You might have seen many patients staying in abroad, even being citizens too, when they come to India, they get all the tests done, all the investigations done, because the waiting time is so low. In India, you can directly meet a super specialist. You say some amount of dyspepsia or some acidity, stomach happening, you directly go and meet the gastroenterologist. It doesn't happen in those developed countries, as you say. You have to meet a general doctor, family doctor, physician. He will write some medication. If that doesn't work, then he has to suggest, he has to refer. There is a care system, primary, secondary, tertiary system that has to be there. But India, that we have the luxury, many patients, they don't understand this factor. Once you go abroad and face some problem, only then you will realize Indians are in luxury in terms of healthcare. So I have personally seen that my mother, who had some illness, she didn't have insurance there. She was on a visit to the US. She suffered so badly. She was trying to curb down the symptoms. Adults, they don't tell the problems properly. But by the time she had come to India, I had a lot of mess to take care of. So I was worried next time when I want to send my parents to the US or abroad somewhere, I have to make sure that their insurance is fully covering their issues. So there are so many things to discuss. Briefly keeping the things in view, first thing is, there are two ways we can deal with. One, from the government, there is no other option that you have to spend money. The quality comes with money. There is no other way. So 2.5% of the total GDP has to be for healthcare. Second thing is, public-private partnership must. The third thing is, public, every person, irrespective of their level of income, have to spend money on insurance. They have to come forward. They have to put a what you call application to the what their local bodies, to make sure that they are registered under this act. Anyhow, we are forming a committee. We want to represent the from the public's voice and the medical voice, saying that how important it is. Fourth thing is, don't try to create panic with WhatsApp groups or everything. With the little knowledge generally public have, so they have enough time. They don't have enough knowledge, but they have enough time and free internet. They keep sharing all the data irrespective of whether it is needed or not. Create panic. Recently there was a pneumovirus, that is one of the old virus that keeps happening with season, but so much of panic was created, and the media was saying in a seki, has the COVID come again? Are the healthcare, are the doctors again starting their leeching business? All these nasty comments. I'm very much angry upon them. This doesn't happen. How, you know how much a doctor has to sacrifice his or her life to get into this stage? People don't know. Many people don't know. Even if they know, the media tries to put the negative factor into way. So please try to understand that health is your priority, health is your responsibility, apart from the government. Whenever you are whenever the politicians, they come for votes and everything, instead of taking for money, just hold them and tell that you want the free healthcare, quality healthcare provided, you will also buy part of it. It doesn't happen that only the healthcare doctors are responsible for the healthcare system. No, it is the government, it is the public, and it is a coordination and respect to the healthcare professionals. If this is the same attitude जो तोड़ फोड़ होता है हॉस्पिटल्स में, कुछ uneventful happening होने से, the doctors, the quality doctors will not stay. They are ready to flee. Okay, there are always opportunities for the doctors. So there are many doctors who want to serve the country, who have better opportunities but still want to give quality care to their patients with passion. Please encourage them. Please don't spread negativity on the doctors, and please don't follow the celebrities blindly in respect of healthcare. They have the best healthcare accessible when something happens to them, but they say that their cancer is cured because of lemon water. Don't believe all this bullshit. Okay, take care of your health. I might sound angry because it's not the frustration, it is some amount of deep anguish I feel sad when our Indians, our people, they take all the wrong advices, all the Insta reels, needless reels into picture, they make them viral. But healthcare videos which have to be proper, healthcare videos content which have to be viral, healthcare policies, health news, this don't go so much of thing. I respect the social media. Because of this platform I will be able to share the video, but at the same time it is our responsibility that only the quality content is there. Okay, so our health is our priority. Please respect your health, respect your body, respect your physician, clinician. Follow advice only as suggested by the physician, not on WhatsApp knowledge. Thank you so much. I will be sharing more videos, and I hope this video is useful. If you find that these suggestions are good enough, please share with your friends, and I will be happy to have your suggestions. I will share my link so that you can share your suggestions, any inputs, any positive criticism. I am ready to accept. There were many videos where some people were criticizing without even listening to the whole video. I I I pity you. So please make sure, get well educated, share your ideas. I am here for you to take positive criticism and make sure that our healthier grows healthy. Health is the biggest factor that drives the societal growth. Thank you.